the need for digital technology as a tool for healthcare delivery is something that needs to be worked on.
I'm hoping and I believe that this event is an opportunity to step back and realign.
I think one of the big ways for us to counter that is to make sure that we expand our financial inclusion in the Philippines.
The best way to move forward from this pandemic is to just not have an exclusive conversation about opportunities available just for government, just for business, but putting the most vulnerable communities at the center of this conversation.
Good morning. We are on the fifth Business World Insights edition. And today we're discussing the healthcare and welfare system. We're on day 3 of the new normal in Metro Manila, at least. Parts of the world are falling apart, but I hope we can have at least a sober discussion, a good discussion, also a fun discussion of one of the big issues that people are thinking about when quarantines end, when the pandemic is contained. And I'm joined by our distinguished guests today. Today's panel includes Dr. Maria Rosario Vergeire, the undersecretary at the DOH, the Department of Health. Director Irene Dumlao, the spokesperson for the the DSWD, excuse me. Dr. Saturnino Javier, the medical director of Makati Medical Center. And Mr. Butch Meily, the president of the Philippine Disaster Resilience Foundation. They will be joining me in the video chat shortly, and some of them will be speaking out their opening statements in a while, and some of the one of them I at least will be presenting a PowerPoint. So my first guest to deliver, the first panelist to deliver an opening statement is Director Irene Dumlao of the DSWD, who is, I guess, one of the frontliners in this fight against the. Good morning, Director Dumlao. Are you ready with your opening statement?
Good morning, Troy.
Welcome to the program.
Thank you very much for having us. It's a great pleasure to be representing the Department of Social Welfare and Development in this very relevant discussion.
All right. The format is that our guests deliver an opening statement, and then for 3 to 5 minutes, and then we'll proceed to a Q&A. And if we have time, maybe closing statements. Director Dumlao, you have the floor.
Thank you very much, Troy. Again, we would like to greet each and everyone a pleasant morning. And again, thank you very much for inviting the Department of Social Welfare and Development in this important discussion. With the rapid spread of COVID-19 and the continued enforcement of the community quarantine, it is recognized that there is a severe long-term impact on the poor and the highly vulnerable families and individuals. The struggle for economic survival is undeniable, particularly for the poor, the vulnerable, and the marginalized. It is also recognized that COVID-19 does not discriminate anyone, and the responses to the varying needs of each sector must also vary. We have social protection programs that protect and prevent people from falling from their current income or consumption levels due to various risks. These are also in place to build capacity and adaptability so that better quality of life is maintained and sustained. It is also present to expand more income opportunities and improve the human capital investments in the long term. And of course, to sustain one's standard of living in spite of people's exposure to various natural and man-made risks. We are all aware that the DSWD, in the midst of the COVID-19 pandemic, is the lead agency in social protection and has been addressing the social impacts of this health crisis in the lives of our fellow citizens. And to support low-income families in the informal sector who have been assessed to be most affected by the imposition of the community quarantine, we implement, together with other government agencies, the emergency cash subsidy under the Social Amelioration Program, which is being delivered to its target beneficiaries with the help of the local government units, other national government agencies, and private groups. Through the Social Amelioration Program, we help caution the impact or the effects of the pandemic to poor Filipino families whose jobs and sources of livelihood have been disrupted by providing them with cash aid, which they can use to provide for their basic necessities. The operational framework of the implementation of the Social Amelioration Program is coherent with the social protection policy of the Philippine government. The clustering of government programs and services under relief and recovery seek to reduce or mitigate the effects of community quarantine due to COVID-19 by providing the basic needs, the urgent responses to socio-economic shocks to vulnerable sectors, and likewise, strengthening people's capacity to respond to risk. We are emphasizing the whole-of-nation approach in addressing food insecurity, hunger, sudden loss of income, and unemployment as among the most important factors to be considered in order to guarantee that the well-being of the Filipino people will be sustained in times of the public health emergency due to COVID-19. It is deemed necessary, as we have always recognized, for the government as duty bearer to ensure that rights and welfare of affected sectors are protected and promoted. The principles of human rights and inclusivity provide a moral grounding to guarantee that all affected families shall have access to programs and services in overcoming the challenges brought by this situation. Multidimensional and multi-stakeholder approach responses has been considered as this is deemed effective and this is deemed an effective strategy in addressing vulnerability. Thus, the whole-of-nation approach, the collaboration of stakeholders, the pooling of resources and capacities has been recognized as effective strategies in improving efficiency and effectiveness of program delivery and implementation. As the title of Republic Act 11469 carries, Bayanihan to Heal as One, we believe that with the strengthened and intensified participation and collaboration with the private and public groups, we will be able to surpass the economic crisis and we will be able to heal and surpass this pandemic as one nation. With respect to the implementation of the Social Amelioration Program, the DSWD has partnered with various local government units to deliver the cash aid to Filipino families who belong to the low-income and vulnerable sector. As provided under Republic Act 11469, there are 18 million families who will receive a cash aid amounting to 5,000 to 8,000 pesos, depending on the minimum wage per region. And that has defined the maximum subsidy that each family will receive. At present, the department has already accomplished the implementation of the first tranche of the social amelioration program, and we are already preparing for the implementation of the second tranche. Again, with a intensified collaboration with different government agencies, we are certain that we will be able to address the needs of the poor, the vulnerable, and the marginalized. Thank you very much.
All right. Thank you, Director Irene, for our first opening statement. Our next panelist will be Undersecretary Maria Rosario Vergeire of the Department of Health, and she is joining us now. USEC, good morning. Welcome to the panel. We are waiting for your opening statement, and you have the floor now. Welcome to Business World Insights. I'm sorry for interrupting you, Sec, but we seem to be having problems with your audio. If we could possibly revisit your presentation in a second once these issues are resolved. So just to recap, we're in the opening statement section of our presentation, and we are viewing a PowerPoint presentation from Undersecretary Vergeire of the DOH. I understand she's logging out, and we will revisit her when her technical problems are resolved. Meanwhile, we will go to Dr. Saturnino Javier of Makati Medical Center. He is the medical director of that hospital. And welcome to the panel, Doctor. And I hope you're having a good morning. And thank you for joining us from out of your busy day. And you have the floor, sir.
Thank you, Troy. Good morning to all the viewers of Business World Insights this morning. It's my pleasure to join here. I guess my job here is to give you a perspective from the medical community of how things were in the last 2 months and how we move forward from here on after the enhanced quarantine has been lifted. I'll probably depict to you two different worlds in March and April. In March and April, it seemed to be very quiet outside. Traffic was negligible. You go out of the house and everything seems peaceful and quiet. But it's a totally different atmosphere when you're in the hospital. You have an emergency room full of patients on ventilators waiting to be admitted. You have an ICU which is full. You have COVID wings which are full. Some of your nurses are being quarantined, if not admitted. And all over you see news of health care workers dying, many of which are my colleagues in the profession, many of which are physicians. And while this is happening, PPEs are being depleted, masks are being depleted, supplies are running low. So these are the scenarios we are confronting in March and April. And while this is happening, the hospital has to confront other issues. Occupancy is down, and while occupancy is down, naturally revenues will fall, even if we are having full capacity in terms of COVID patients. The non-COVID admissions are down, elective surgeries are stopped, clinic offices and doctors' clinics are closed. So the impact is a double whammy kind of situation. We are low on occupancy and therefore revenues are low. And while we are doing that, while we are confronting that, we spend a lot on PPEs, some of which have been exorbitantly priced by unscrupulous distributors and manufacturers. So from that perspective of chaos, we have hopefully moved beyond a chaotic situation as we approach the new normal, quote unquote. And from a situation where we have employed very aggressive and encompassing measures, we now move to resumption. And as we have emphasized in Makati Medical Center, we resume in a very cautious manner. It's supposed to be gradual, partial, and limited. And as we move to the new normal, this is now a situation where we try to manage fear. And this fear cuts across sectors. Fear of the patients to come back, and fear among our healthcare practitioners or professionals to once again embrace clinical practice. And so part of our job in the administration and leadership is to ensure that everyone is safe. Patients are safe, healthcare workers are safe, physicians are safe. And this we achieve by ensuring and putting in place many measures, all geared towards safety and protection of everyone in the hospital. Aside from the adoption of the no mask, no entry protocol, we ensure that we have zoning protocols in place, both in the emergency room and in all the floors of the hospital. We provide adequate PPE supply, including masks for all. Many of our clinics have been retrofitted to ensure that they're able to confront any possible break in infection and containment protocols. We have designated traffic routes for patients in the hospital. We have designated hotspots and cold spots, meaning the COVID wings and the non-COVID areas. Appointment is strictly by telephone appointment, and some strict protocol by way of questionnaires will have to be in place. So all of this will somehow manage that fear among the patients and fear among the healthcare professionals, so that we will be able to embrace what we have been referring to as the new normal. And hopefully, with the new normal operations in place, we will be able to bounce back. And while doing that, we hope that we are not putting our guard down in terms of managing the pandemic in our midst. I think I will stop there, Troy, and entertain questions later on. Thank you very much.
All right, thank you. Thank you, Dr. Javier. Okay, that was very eye-opening. You would expect that hospitals would be full now, but apparently they're not. So we will move to Butch Meily of the Philippine Disaster Resilience Foundation, who will be joining us with an opening statement. And off the air, before we started, I was asking you about how different this disaster is to your usual line of work. Maybe you can expound on it when you start delivering your opening statement.
Sure, Troy. Yeah, thanks. Well, you talked about the difference in disasters. For one, we've been in Marawi, we've been in Cotabato for the earthquakes, Zamboanga for the siege, we've been in Taal for the volcanic eruption, we've been in Yolanda. I was there in Tacloban a few days after Super Typhoon Yolanda hit. We've actually been doing this through Ondoy, if you remember Ondoy in 2009, when the streets of Manila were flooded. So they were all different, but this pandemic is truly different in the sense that it affects not just one area of the country, it affects the entire country. It's also difficult to respond because our own staff are at risk. And so we're extremely careful. And some of the remedies are similar, and I'll point to that in my PowerPoint as we go along. Let me just start with the, last week I was at, following Dr. Javier's statements, I was at PGH to distribute PPEs and ventilators as part of Project Kagapay. I'm going to be at the Red Cross in about an hour and a half. And the whole idea here is that the private sector is working with the government and the health sector in terms of responding to this current crisis, because it is so far-reaching and affects everyone. We were able to raise something like almost 100 million pesos for to provide PPEs, ventilators, testing kits for mostly government hospitals, but also private hospitals as well. And we realized the infection rates are quite high in these hospitals. So we're concerned. There are frontliners. They're part of everybody's system, and we're going to need them. So we focused on that as one of our initiatives. Next slide, please. Our biggest effort, though, was that we realized that many people, if they don't go to work, they don't get paid. If they don't get paid, they don't eat. And so we mobilized quickly in the initial days of the lockdown and curfew, and we were able to raise 1.7 billion pesos and distribute these grocery gift certificates to almost 13 million people around the greater Metro Manila area. And we worked with Caritas on this. We practiced social distancing. We tried to equip the priests and their parishioners with PPEs and masks so they wouldn't be infected, and luckily they were not, but they went house to house to do this. Next slide, please. We also focused on trying to help the medical professionals in this battle. We partnered with both Brown University in the US and Project Hope, and we started a series of teaching webinars for medical professionals. And so far, we've managed to train over 1,500 health workers and professionals. These webinars are free. They're restricted to doctors, but this has really picked up in the last few weeks. Next slide, please. In addition, we've provided buses for the Philippine Army to transport health workers to their place of work. Next slide, please. We've also provided planes to pick up nurses from the provinces to bring them over to Metro Manila where they're badly needed. We've ferried medical supplies from Manila to outside areas. In addition, because of a pre-agreement with UPS, they're able to pick up fabric to make PPEs locally from China, transport them here free of charge, and we worked with the DTI on that. Next slide, please. We also have a pre-agreement with Airbnb, and the idea is to provide residences and hotels for health workers when they go home, so they don't have to commute. We're actually, some of the Makati Med nurses were able to stay at these hotels. So we were glad to do this, and the partnership with Airbnb was key. Next slide, please. Now, Troy, I mentioned there are some similarities in disasters, and the similarity is really in terms of reopening the economy and trying to revive the supply chains and the sari-sari stores and the small businesses all around the country. We launched Project CCAP, which is aimed, it's a one-stop digital shop for MSMEs, small and medium-sized enterprises, to answer all their questions and help them get back on their feet. Where do I get a loan? How do I regulate the paperwork? We provide mentoring as well, and we also provide guidelines in terms of the difference between ECQ, GCQ, and all these different quarantines. Next slide, please. The other similarity is that during Super Typhoon Yolanda, we helped revive the sari-sari stores in Tacloban. In this current pandemic, we expanded it to about 400 stores in the Metro Manila area as a pilot program. We assembled a consortium of consumer good companies and telco companies to work together. Many of them compete with each other. These are Coke and Pepsi, Smart and Globe, Procter & Gamble, and Unilever, and Happy Toothpaste. The idea is to provide a package of goods to supermarket owners so that they can restart their stores. Because the problem is, we found out in a survey that up to 40% of them had closed, either due to health concerns or because, to be honest, many of their consumers were not able to purchase their goods. So we did a focus group, and you'd be surprised at how knowledgeable then they're all lady entrepreneurs are. They're very conscious of their safety and the flattening the curve that came from them, and they're going to be reopening with plastic and all that. Next slide, please. Finally, we're also helping 12 other countries around the world as part of the UN's Connecting Business Initiative. PDRF is providing support, COVID-19 tutorials, and other types of support, business continuity ideas, how to keep their small businesses going, to 12 other countries. And we're proud that we're doing that. The Philippines is ahead in many ways in terms of what we're doing. And the key is a partnership between the government, the health sector, and private sector and NGOs. Thanks, Troy.
Once again, I apologize for the technical difficulties. We weren't able to receive the opening statement of Undersecretary Vergeire, but we will bring her in once those difficulties have been resolved. And I'd like to proceed to the Q&A side of our panel discussion today. Director Irene, one of the things that I have noticed is that people seem to be saying that the national ID would have helped aid distribution a lot during this pandemic. There were difficulties reaching beneficiaries. There were a lot of reports that the lists were incomplete. Do you think the national ID would have helped?
Well, Sir Troy, the national ID system would have helped in the identification and in the distribution of the cash aid to the beneficiaries of the social immigration program. While the DSWD has its own listahan, wherein this was the basis in identifying the beneficiaries, not only of the social immigration program, but also in targeting the beneficiaries of other social protection programs of the department and other government agencies. Again, it would have been helpful if we have this particular platform or this particular mechanism so that we could have improved and we could have efficiently delivered the aid needed to our beneficiaries. It would have also been helpful since the national ID system would have been able to link our citizens or our clients and beneficiaries to banking or financial institutions that would have expedited the aid to them.
Can you give us an idea of what the setup is like? Is there overlap between the four-piece beneficiaries and the Bayanihan to Heal of One beneficiary? I understand that the Bayanihan beneficiaries were like 18 million under the law, but the first month of the SAP reached, according to reports, 12 billion, and maybe they're reaching 17 million by the second tranche. Can you give us an idea of what the setup is for distributing aid?
Come again, Sir Troy?
Can you give us an idea what the setup is like for distributing SAP? I think I think you're on target to deliver to 17 million people in the second tranche, and I think that was the first month of SAP, 12 million. So, can you give us an idea how aid is distributed and the role of LGU?
Okay. Well, Sir Troy, for the first round or for the first tranche of the social amelioration program, the DSWD partnered with local government units for the identification and the distribution of the cash aid to 18 million families. Actually, we have already identified more than 4.2 million beneficiaries of the whole piece. We have already excluded that from the 18 million. So around 13.8 million families were identified by the local government units. For the four-piece beneficiaries, since we have already identified them, we immediately distributed or released their cash grants through their card accounts. Well, to majority of them. And then the 13.8 million families identified by the local government units received their aid through actual payouts done or conducted by the local government units. Now, for the second tranche, we will be partnering with the Armed Forces of the Philippines and the Philippine National Police in distributing the aid to the families considered as recipients or as to the families in ECQ areas who will be the recipients for the second tranche. Likewise, we entered into agreement with several private groups, uh, particularly GCash and PayMaya. These are online or digital platforms that could help us in distributing the aid to the beneficiaries for the second tranche. Likewise, we have recently launched the Relief Agad application, wherein it has an interface with online or electronic wallets that could again, assist us in expeditious release or distribution of the aid to our beneficiaries.
Okay, thank you. Thank you. We'll get back to the Q&A later. I understand that USEC Vergeire has rejoined us, so we will be hearing her opening statement, much delayed, right now. Dr. Vergeire, welcome. You have the floor. I hope things
Yes,
are resolved.
yes, good morning. I'm sorry for the technical difficulties a while ago. I'm not going to present anymore. Just so that I would not shorten our Q&A portion, I would just like to tell everybody that the COVID response that has been done by government since the start has been a whole of society, whole of government approach, and where we are focusing on the vulnerable, of course, prioritizing them. We already have improved in so many ways as to our capacities for laboratories. We started off with just one laboratory, and now we have a total of 52 laboratories licensed by the Department of Health. We only had 300 testing capacity start of this response, but right now we have at least around 34,000 rated capacity for our laboratories. We already have COVID referral hospitals. We have COVID accepting hospitals. We have a number of temporary treatment and monitoring facilities for our quarantined individuals. Also, we have Ligtas COVID centers in our local government units. We have procured different logistics in aid of this response, including the PPEs for our healthcare workers. We have the emergency hiring program for our health human resources so that we may be able to provide and augment health human resources to our hospitals and our quarantine facilities as well as our primary care facilities. So for now, we are engaging with all of our partners, especially the private sector. We have this T3, the Test, Treat, and Trace, which is a partnership with the private sector wherein they are now providing us with the utmost support in terms of the capacity for laboratories, in terms of swabbing facilities, in terms of managing the OFWs, and the other partnerships that we are undertaking right now such as setting up pop-up labs or modular laboratories in different areas of the countries, and establishing huge centers for laboratories. So these are just some of the efforts of the Department of Health to work together with our partners in this response for COVID. Back to you, sir.
I'd like to resume the Q&A with you again because to bring us back to the bigger picture of universal healthcare, which was supposed to start this year. Do you expect the pandemic to interrupt or disrupt UHC in terms of funding, in terms of what the planned rollout was, since a lot of resources were diverted to the COVID effort? Do you think this will set back UHC?
Universal health care, as you know, as we have started already implementing this UHC, even though we have this pandemic, as we say. We already have enrolled, or as all Filipinos are automatically members of PhilHealth. So all of those individuals who has been affected by this COVID-19 has already been able to get or has benefited from the PhilHealth rates or benefit packages start of this pandemic. Also, we are not excluding the non-COVID pathway wherein the other essential services are also covered by PhilHealth. As to the other provisions of the law, we are also implementing it already, like the primary care network, the healthcare provider network, which we are using right now for the referral system in our hospitals across the different facilities in each of our regional areas. While the other provisions of the law has taken the back seat, but we are very eager to push forward and implement this in the coming months as we go through this pandemic, also realizing that there are still other non-COVID services for health that our people are entitled to.
Okay, you mentioned PhilHealth. Do you think PhilHealth is adequately funded for this emergency? Do you think it could use a little more money, or what sort of percentage of a typical medical bill can PhilHealth cover right now? Would you know?
Well, prior to April 15, they covered the whole set of medical bills that all individuals affected by COVID has incurred. But after April 15, they have issued out this new benefit packages, especially for COVID-19, where they are now covering pneumonia cases and also for testing and also for quarantine facilities. As to the other services that are not included as part of these COVID-related benefit packages, the usual case rates will apply. So I think PhilHealth right now providing these different benefit packages and also trying to expand the other services or benefits for the other services is still fluid as of this time.
All right, thank you. We have a question from the audience, and it's directed at Dr. Javier. So, will doctors and hospitals embrace do you think doctors and hospitals will embrace telemedicine after this crisis, or and could you please tell us what you're doing in terms of online scheduling platforms, appointments, and so on? Since people can't really do face-to-face medicine very much right now.
Thank you, Cheryl, for the question. Yes, even during the height of the pandemic COVID cases, we have encouraged many of our practitioners to embrace teleconsultation or telemedicine to be able to connect with the patients who have no opportunity to visit them in the hospital. This was still encouraged, or this is still being encouraged as we partially resume operations, and all our doctors have been encouraged, and we support them in whatever platform they would like to utilize in the telemedicine or telehealth modality that they would like to get into. And we have also come up with provisions and policies and protocols to ensure that there is a seamless manner by which patients can be able to communicate with their physicians regarding appointments, regarding schedules, and everything. So yes, the short answer to the question is we fully embrace it as a form of connecting with our patient populations. Thank you, Troy.
Doctor, I have a follow-up question. Are you seeing any pressure on the supply of medical professionals and nurses and techs because of the chaos of treating people during a pandemic? Some of them have had to be quarantined. They have to be on rotation so they don't all get infected at once. And also, rich countries are trying to poach our nurses. So can you, and maybe some doctors are having second thoughts about practicing dangerous parts of medicine, and maybe they all want to be in a safe part of medicine. Can you give us an idea how this pandemic has affected the supply of medical professionals?
Thank you, Troy. Well, certainly there are manpower issues, especially with our nursing sector. Although with physicians, I don't think there's much issue there. We still have the same community of physicians, at least in my center, who are still with us and still willing to embrace the new normal. But in terms of nursing, that has been one area which I don't think is unique to us in Makati Medical Center. We have a good number of nurses who left us during the height of the pandemic, and you cannot blame them. When personal security or health issues on the line, you cannot impose on anyone to stay, especially if there are offers of higher salaries elsewhere. This is a reality we confront and are still confronting at the moment. And we try to manage this in ways that we will be able to entice nurses to stay on. And we've come up, our HR units have come up with some ways to do that. Career advancement opportunities, flexible work hours, compressed work week schedules, and then you try to increase the benefits. But if the bottom line is salary, we really cannot compete with our European countries and the United States, especially when the demand for nurses in those areas is much higher. And I think that's one area where we can be helped by government to put some stopgap measures to prevent the brain drain insofar as our manpower is concerned. Thank you, Troy.
Thank you, Dr. Javier. Butch, I was struck by something you mentioned in your statement about how women are more cautious about social distancing. That sounds like something from microfinancing, where women are supposed to be better lending risks. Do you have any other insights from this disaster that maybe could help future disaster relief strategies, like focus on the women or something, a short formula that can be described as your learning from this disaster?
Well, in terms of reviving the economy, I mean, what we've discovered, Troy, is that you're correct, no? Microfinance institutions only lend to women entrepreneurs. They have their reasons for that, because women may be more family-oriented, maybe they can be more trusted, maybe if you give me money, I'll go out and spend it on a party. I'm not sure. But women have played a big role, and among the sari-sari store owners that we've interviewed, 80 to 90% of them are women. So they play a key role in the recovery of the economy and in holding our families together. So that's really important. Now, in terms of lessons from disasters, what we've learned is that having pre-agreements in place with companies like UPS, Airbnb, and hopefully other companies in the future have really served us well, because with UPS, we've been able to get planes and trucks to transport goods. Actually, we've worked with DSWD on that, and I believe also PH, and pre-agreements with Airbnb. As we said, we've been able to use their residences in this current pandemic. So we've been continuously deployed. We're a fairly disaster-prone country, but since October 31, we've had 3 major earthquakes, 2 typhoons, actually 3 typhoons, 1 volcanic eruption, and then the pandemic. So it's been a hectic period. I hope the rest of the year of 2020 will be better.
Well, we're in typhoon season now, so you probably won't get much rest.
Well, I'm praying.
Well, Dr. Vergeire, back to you. Does the DOH have a position on private testing by companies as the workforce returns? I understand that the DOH has a certain gold standard test for determining whether patients are positive or not, but there are other kinds of tests that are available commercially to private employers who would like to test. And in fact, we are receiving reports that they are testing their employees when they return to the workforce. Does the DOH have a position on private company testing?
Yes, we have issued the return to work policy guidelines of the DOH, wherein we have recommended that it should be symptomatic screening, because a lot of employers and a lot of companies have been calling DOH and asking if they can mass test their employees. And our response to that was this policy on return to work, where we have stated specifically that we are recommending, based from the recommendations also of our experts, that it should just be symptomatic screening, meaning upon resumption to work, all employees should be screened, and all those who have symptoms has to be tested and isolated. Also, those who has had symptoms 14 days prior to resumption to work or prior to going back to work, they also need to be tested and isolated. As to those companies who had been doing this mass testing of their employees, the DOH's position would still be symptomatic screening using the RT-PCR method of testing.
All right. Thank you. Dr. Javier, in your presentation, it seemed like the problem with hospitals is confidence, because people are afraid to go to hospitals now. Those who are not sick with COVID, like those people who have diabetes, for instance, or those people who are at risk of being infected, they're actually afraid of going to hospitals. In fact, some hospitals help propagate that message by saying, don't go if it's not an emergency. Since confidence in the broader economy is also an issue, what are the confidence issues specific to hospitals? How do you reassure your staff and your patients that it's safe to go to a hospital again?
Well, I think the overarching consideration there is to communicate, Troy, to the patient clientele on the kind of measures that you have put in place to ensure their safety as they come back. And we have tried to do that by way of disseminating information regarding the capability, at least in my center, and I'm sure most other centers have done the same, of ensuring and putting in place many of the things that we feel are the best measures to protect them, not only them, but also our doctors. And I have enumerated some of them a while ago regarding the kind of policies that we have instituted to bring back that confidence, Roy. You are very correct there. And it will take some time, really, for everyone to embrace the new normal and to get the reassurance that everything is fine. But at least from where I sit, I can see somehow a changing perspective, because the number of patients coming back is somehow increasing already. Maybe not very dramatic, but you see that on a day-to-day basis, the numbers are improving, Troy. And to me, it's a good sign. Also, the number of doctors willing to come back is also improving. So you see the confidence level building on both sides of the population, Troy. And to me, these are all positive telltale signs that with the new normal, we are still able to embrace it as part of our new society.
Is there like a technological solution, like an AI solution to the confidence problems and maybe the manpower problems? I was speaking to a friend who says one of the actual bottlenecks in treating patients is like diagnostics and blood tests, and that is a field that can easily be, I guess, supplemented with AI. Like the AI can analyze your sample and then tell you the result faster than a human tech can. And we're losing a lot of techs also, I think, to overseas recruitment.
Well, of course, technology has always have a significant role in all of this. But you see, Troy, nothing can really substitute a physical, face-to-face interaction with physicians, no matter how limited. What we have done is to limit or minimize physical interaction in the facility. And that is where we try to harness the full potential of technology. So we use online scheduling, we use online interrogation or questioning so that those preliminary questions can be addressed ahead of time. So for example, they just need a testing for COVID. They can right away get that information and we can provide them the place where to go in the hospital with a request already. So you have eliminated a good number of steps before you can even come to the hospital. And to us, that's a way of harnessing technology to make sure that we ensure the safety of the patient clientele as well. So both ways will be useful in terms of embracing the new normal in the hospital.
Thank you. Director Dumlao, we spoke briefly about 4Ps a while ago, and it's directed at some of our most vulnerable populations. One issue about this pandemic is that many people might be falling into deeper poverty, or people who are prosperous suddenly become poor. Is the 4Ps equipped to maybe to absorb the newly poor people or the vulnerable who have been impoverished by this pandemic?
Well, yes, Sir Troy. We are all aware that the 4Ps or the Pantawi Pamilya Pilipino program, this particular cash transfer, has been recognized, particularly in the Yolanda experience, wherein we were able to prove that cash transfer programs are effective in addressing the needs of the most vulnerable members of the society. In this particular period, that there are more families affected by the crisis, and their vulnerabilities have been further exposed or further placed at risk. The DSWD is ready to make sure that social protection programs are in place. We don't. We are all aware that the 4Ps program caters to families with children who are enrolled in school, or families with pregnant women, because 4Ps is an investment in the human capital, and it addresses intergenerational cycle of poverty. So if an individual or a particular family does not have children, chances are they will not be included in the program. But then again, the department has other programs and services that could cater and address to their particular needs. I would like to cite as an example the social pension for indigent senior citizens. They are also members of the vulnerable sector, and yet they will not qualify for the 4Ps program. But we have this social pension that provides 500 pesos aid a month to the qualified beneficiaries. And this is one of the services or programs that we are implementing so that we could address the needs of this of the elderly or of this particular sector.
All right. Thank you. I'm taking a question from the floor now, and it's directed at Butch Meily. we are vulnerable to natural and man-made disasters. We've had disasters like Ondoy and Taal, plus the Marawi siege, which is man-made. How have you seen any improvements in our disaster response capabilities over the years? What key lessons have we learned up this point? Over to you.
There's been tremendous improvement in our response capabilities, especially in the part of the government and the private sector. If you remember on Doi in 2009, we had no Doppler radars. So that Saturday morning, I think it was November of 2009, we knew there was a typhoon, but nobody realized how much rain was heading our way. Today, we've got 16 Doppler radars. Today, the national government is quite active in pre-evacuation procedures. So the casualty rates have gone way down after Super Typhoon Yolanda. The idea, I think, that's important is that a TFA, public-private sector partnership. PDRF was started after Typhoon Ondoy in 2009. We worked together with OPAR of now Senator Lacson after Super Typhoon Yolanda. And in the pandemic, we're part of the T3 task force that the Undersecretary Vergeire mentioned. Several companies, Ayala, Unilab, and Metro Pacific Hospitals, San Miguel, they're all helping ramp up the country's PCR testing, which is a challenge. And we're also part of the group helping repurpose local manufacturing facilities to make PPEs here in the Philippines instead of having to import everything from overseas, since it's a global marketplace and we're competing with so many countries for these ventilators and PPEs right now. So we're working with DTI on that, and I believe the DOH as well. So we're in there. I think later I'm seeing Secretary Galvez and Senator Gordon for a handover of ventilators and PPE suits to the Red Cross. So I think that idea that we're all in this together, that's helped. And I think the capabilities of the Philippines have improved tremendously since 2009. So that's a source of comfort. In fact, we're way ahead of the rest of the world in some of these efforts.
Okay, thank you. I'm taking I think we've lost Yusek Vergeire. So, because the next question from the floor was directed at her. Butch, I'd like to throw another question to you. You mentioned that you were helping with Libreng Sakay programs. And now that the workforce is returning, what do you see on the ground with people who are trying to get to work but finding public transport inadequate so far?
Well, we were helping the Philippine Army with buses initially to transport health workers. But what's happening today is that at some point you've got to reopen public transport because people are not going to be able to get to work really just using Grab or the existing transportation system. They're going to need the buses and all of this. I think the key is to practice social distancing, and we'll follow the guidelines of DOH here, and to have masks and so on. But if people are going to be able to get to work, they have to be able to have a means of transportation. And that means what we've got is what we've got. We've got the rail system, we've got buses, and I know there's a debate on jeepneys, but it's a question of whether people can get to work and get to be paid and get to eat.
All right, thank you. The next question from the floor is for Dr. Javier. I don't know if it's a question. It's actually worded as a more or less a statement. Minimize interaction in the facility, and this is how we harness the potential of technology. So I guess it has to do with whether patients can come in and do face-to-face work with their doctors. Do you see any trends in hospitals towards minimizing contact and maybe reducing the risk of infection?
major efforts are really towards that direction to minimize physical contact. As I have mentioned a while ago, it's one way to ensure that the virus is not able to transfer from one host to another, and therefore minimizing contact by way of physical distancing, by way of ensuring that you don't have any gathering in the hospital among our trainees, for example, among our patients and the doctors. Those are all ways to minimize contact, and certainly this will go a long way in preventing and containing any possible outbreak in any unit of the hospital, Troy.
Okay, thank you. I'm taking another question from the floor, and it's directed at both private sector and public sector guests on the panel. Would you recommend any legislation right now that will address the problems that you're encountering to better equip us to handle pandemics and other disasters? I'll start with you, Director.
As I have earlier mentioned, private and public institutions could actually really work and collaborate to define, develop, or formulate responses for crises such as the COVID-19. While there are specific measures that we could suggest or recommend, what we could do foremost is to have a consultative meeting with our private groups so that we could define the responsibilities of each area, of each sector, and come up with areas of collaboration. From there, we could probably submit our recommendations to our policy actors or our legislative actors so that they could study it further and pass it into a particular legislative measure.
All right. The question was addressed to everyone on the panel. So, does anyone have any other possible legislative proposals for Congress? Since they seem to be in the mood to pass a lot of emergency legislation right now.
Well, I think, Troy, I don't think we are running out of laws. They just need to be implemented very well. I think the idea is not to craft new laws, but to put muscle and teeth into the existing laws. And I can enumerate a number. We need to ensure steady flow of medicines, testing kits, and everything. We need to ensure that there's good regulation of prices of PPEs and supplies. I will tell you, Troy, at some point in time during the surge of the cases, the N95 mask, which used to be priced at like 80 to 100 pesos, was skyrocketing at 350 plus. 350 plus. We, of course, didn't bite into that because it's really exorbitant and will cripple us. But we had to, at some point in time, buy this kind of mask at 150, 180, just to make sure that we have good quality masks for our healthcare workers. So that's just one way of trying to make sure that all this work for our benefit. So ensuring regulation of prices like this will definitely go a long way. Regulation of the supply chain of medicines and PPEs. Should there be vaccination in the horizon? And I think you will agree with me, at some point in time, the acceptability of vaccination in the community has gone down. If we are going to embark on another vaccination program, we need to re-educate and disseminate to the community, the grassroots, the value of communication. This has become a setback in the previous years. It has affected the acceptability of this program into the general community. So I think these are just some of the things that I feel can become part of the wish list should there be more need for improving the implementation of our laws. Thank you, Troy.
Thank you. Butch, do you have a legislative wish list for, just to address a general question about, can we implement more laws? Can we enact more laws?
Well, I tend to agree with Dr. Javier. We have a lot of laws. They're just not implemented. But there are two things. One, the economic stimulus for small businesses. I think that's important that they get that to help these small businesses that really need it, because so many of them have closed and people are struggling. They're scared and they're struggling, and they're really being knocked back into poverty because they're using up their savings. The other law is the national ID. I wasn't sure about that myself, but now I believe it's going to help in terms of contact tracing, in terms of securing our voting process, in terms of delivering the cash to the people that need it, and not double counting. So I think that's important.
All right. Thank you. For Director Dumlao, there's a specific question that is related to the social amelioration program. What happens to the SAPs that were returned by some recipients? Does it go back to DSWD, or can the LGUs reallocate the returned SAP funds for other low-income families who are not covered? So some people have returned their SAPs, apparently, and what happens to that?
Yes, Sir Troy, we actually commend the SAP recipients who have received funds or the cash aid and have honestly returned this amount to our local government units. Based on our existing guidelines, all refunds will have to be accounted for. So the SAP recipient would have to return that to the local government unit, considering that the DSWD has entered into an agreement with the LGU for the transfer of funds and for the LGUs to distribute it to their target beneficiaries. Considering that the recipients have returned it, they must request for an official receipt as a proof that they returned the aid that they've received. And then the local government unit will have to submit a liquidation report to the DSWD field office reflecting that certain amounts have been returned to the LGU. And such amount, as part of our accounting rules and procedures, will have to be returned to the DSWD field office. This amount will be used by the department in providing aid to other beneficiaries identified or those among the list of waitlisted. So essentially, we will still be using the fund to provide assistance to those identified beneficiaries.
All right, thank you. Another question from the floor. I guess this is for Dr. Javier to answer. With the need for additional PPE and safety protocols, will small hospitals, clinics, dentists struggle under this new requirement to keep patients and staff safe? Perhaps you speak for Makati Med, but perhaps you also have an insight into how other hospitals operate.
Well, there are really situations where the risk is higher, like dental procedures, for example, or anything dealing with the respiratory tract or the throat, ENT services, and they will naturally have to embrace the requirement to protect their patients as well as the practitioner of possible infection. I think the mindset to adopt is you presume that everyone you are coming across is a potential carrier or a potential infected patient, no matter if the patient has no symptoms or not. And by doing that, you naturally have to protect yourself, no? So this is a two-way imposition of protective measures, not only for your patient, but for the healthcare worker as well. And I think this will be very important. Again, it will cut through fields of specialization. Most of the clinics in my center, as I have mentioned, have retrofitted their clinics to be able to respond to this requirement, right?
All right. Thank you. I've been informed that we are close to using up our time, so I think we will proceed to closing statements if you have any last words, or maybe if you'd like to interact with the other members of the panel to ask them like questions about things that they specialize in. Director Dumlao, any closing remarks, please?
Well, Sir Troy, thank you very much for this opportunity that we were able to join you and all your followers in this morning's discussion. Again, we wish to reiterate that the Filipino families, whether poor or non-poor, face various economic, environmental, and man-made risks. Managing such risks is important for families to prevent them from falling into or falling deeper and be trapped into poverty. We must ensure always that the poor has to be protected from the negative impacts of natural and man-made risks, and of course to support their efforts, to support the efforts of not only of the government but other groups, so that they could manage properly the risks. The government has a big responsibility to promote and protect the welfare of the poor, the vulnerable, and marginalized. But the private groups also play a significant role. Social protection programs are needed to enable the poor to handle and eventually surpass risks as a result from the crisis that we are facing, particularly COVID-19. Managing all of the risks will eventually help the poor, the vulnerable, and the marginalized exit poverty and lower their exposure to vulnerable situations. And that is why, again, we would like to mention that the collaboration between the government and the private institutions or groups play an important role in ensuring that we address the vulnerabilities of the clients that we all serve. Again, let us take in consideration the plights of the people who belong to the lowest sector of the society. We have to consider and ensure that appropriate interventions and assistance are afforded to them. With the strengthened partnership between the government, the private groups, we could ensure that more sustainable efforts will be delivered to our clients or to our beneficiaries who are poor, and we will be able to ascertain that we could uplift the current situation and we could all heal as one nation. Thank you very much.
Okay, thank you, Director Irene. Butch, since you typed ready in the chat, I will give you the next slot for closing statements, since you seem enthusiastic about. Let's hear your last word on it.
Well, we've learned many lessons from this pandemic, but probably the most important is that we're all connected. What happens in a city in China that we never heard of has affected every single human being on this planet. So if somebody gets the COVID virus in Italy or in New York or in Navotas, it affects all of us. And I think that's the key lesson that we've learned, that we've got to look out for each other. And it's never been truer that we are, in fact, our brother's keeper. Thanks, Troy.
All right. Thanks very much, Butch. Dr. Javier, you have the last word.
Troy, can I just make a comment first before I give my last word?
Yes, please. Yes.
This is for Butch. Butch, aren't you glad that the COVID outbreak did not coincide with the Taal volcano eruption? Because when we were planning for this pandemic response in COVID, because we had news of Wuhan outbreak sometime January, we were just planning to respond to the Taal volcano eruption, and days lang yung binilang natin, just a matter of days before the first cases of COVID came to Makati Med. And you know, from where we stand in Makati Med, we were just glad that these two situations did not overlap, because you can imagine the need for masks if there was a volcanic eruption side by side with the need for masks during the COVID outbreak. And I just wanted to share that insight with you, Butch.
No, I remember January 31, we had a forum, and the focus of the forum was on the response to Taal volcano. But we added one section, and we asked the DOH to show up on the COVID virus. And that's what drew people. That's why we were so full, because even then people were scared. Had we acted maybe sooner, because they're already getting reports about Chinese tourists in the country who were sick. And they're asking whether or not we should start banning the travel of these tourists to the country as far back as then. But yeah, that's our nightmare scenario. But we expect that to happen, to be honest. We have Typhoon Ambo that already happened. And we have a couple of typhoons and potential earthquakes on the way. So we're preparing for that. We actually had a simulation for it with the UN. And we use local NGOs. But the problem would be responding. I mean, you see it in the States now. How do you respond to riots when you've got the COVID virus? We're going to have similar problems in this country in the future. But thanks. Yeah.
Well, more power to you guys. But in closing, Troy, I also would like to thank BusinessWorld for this opportunity to join you and your esteemed other esteemed panelists this afternoon. I think in closing, this should be a good time to remind everyone that even as we resume hospital operations, and we have tried to provide every measure to ensure your safety in all our protocols, in all our policies in the hospital. We need to keep in mind to remember the many things that we have to do as our share in trying to prevent the infection from involving us. We have to keep in mind that the virus did not go on quarantine. It's the people who did. The virus is just there. It did not go on vacation. Once it finds a suitable host again, it will definitely be causing havoc again. And I think we've seen it in other countries as well, in South Korea, in Singapore, even in China. They've seen a surge again if people do not adhere to the precautions that we are trying to make the community aware of. And this should be a good time to keep in mind those important lessons, Troy. Thank you very much.
Thank you, Dr. Javier. That concludes the final statements of our panelists. I would like to thank Director Irene Dumlao, Butch Meily of the PDRF, and Dr. Javier of Makati Medical Center. And that wraps up our fifth BusinessWorld Insights session online. I'd like to thank our sponsors, Globe, Entergo, Unilab, Seagate, Pag-ibig Fund, and our platform today was provided by O'Learn, and the next video online Insights edition will come next Wednesday on June 10, and the topic will be focusing on the value of the labor market and MSMEs. As it is with this panel, it's like live and free, and it's available on BusinessWorld and Philippine Star, the Facebook pages of those two publications. I'd like to thank you all for logging into today's BusinessWorld Insight session, and I hope you have a safe new normal. And BusinessWorld will see you again next week. Thank you.
The need for digital technology as a tool for healthcare delivery is something that needs to be worked on.
I'm hoping and I believe that this event is an opportunity to step back and realign.
I think one of the big ways for us to counter that is to make sure that we expand our financial inclusion in the Philippines.
the best way to move forward from this pandemic is to just not have an exclusive conversation about opportunities available just for government, just for business, but putting the most vulnerable communities at the center of this conversation.